Hello, I'm Dr. Dana Jing. I'm a board-certified dermatologist practicing in North Austin at Spicewood Dermatology. I'm excited to tell you today about Ultherapy, which is an FDA-approved, revolutionary, non-invasive procedure which lifts and tightens the skin of the face and neck. It uses precise ultrasound energy delivered at specific depths in the skin to cause muscular contraction and collagen formation. It is non-surgical, as I mentioned. It does not involve needles or blades, and so there's very little downtime. There's actually no downtime. You can return to work immediately afterwards. Here's a brief video clip that illustrates how Ultherapy works.
Ulthera uses focused ultrasonic energy to create thermal coagulation points, TCPs, in a matrix at defined depths. The system reliably coagulates tissue at 65 to 70 degrees Celsius without ablating it. This finely focused energy creates the right temperature to produce precise and predictable thermal coagulation points, TCPs. These TCPs contract the surrounding tissues and initiate the wound healing response that results in the formation of new collagen. The ultrasound energy affects only tissue at the targeted focal point, leaving the intervening tissue, including the skin surface, unaffected.
I'm happy to introduce Stephanie Kemmerling, our advanced practice nurse who performs our Ultherapy treatments here at clinic. She has been recognized as an outstanding Ultherapy practitioner and has received advanced training courses to customize each and every individualized treatment. We also have Tracy here, our patient.
Tracy is a 39-year-old woman, and she has just begun to notice some changes in her face.
I have. I've noticed my eyelids seem a little bit heavier. I feel like I'm sort of beginning to get a double chin. My neckline feels a little bit less defined than it was in the past. I really would like to just look refreshed, feel a little lifted, tightened perhaps.
Well, Tracy would be a really good candidate for Ultherapy because with Ultherapy we could achieve a natural brow lift, and that would give her a more wide-opened eye appearance. In treating the cheek, we could reduce the appearance of any lines that she's begun to notice on the lower face. And in treating the neck, we could tighten the skin and reduce any excess tissue that she's noticed.
Great.
At Spicewood Dermatology, we thoroughly research any procedures, new technology, and products before offering them to our patients. We have been very excited about Ultherapy, and our patients have been very satisfied with treatments because it is safe, it's effective, it's non-surgical, there really is no downtime, and we see great results. Ultherapy has been FDA approved since 2009, and the company continues to research and perfect the methodology to make the treatment more comfortable. Very safe, very effective. We continue to see improvement over the 3 to 6 month period and even beyond. So I hope you have found this session informative, and we'll see more of the treatment in the next segment.
One of the features that makes Ultherapy very safe and consistently effective is that because it uses ultrasound, we're able to see through the skin to the area that we're treating. So when we look at the screen, we can see the top layer of skin, Tracy's epidermis, the middle layer of skin, the dermis, the fat layer or adipose tissue, and then the muscular layer, which is where we'll be delivering the energy. Before Ultherapy, the only thing that could really reach that muscular layer was surgery. We're beginning Tracy's treatment now. We're going to deliver our first line of energy. Tracy, how did that feel?
It felt like some warm pinpricks, not that uncomfortable at all.
We've treated Tracy's neck and cheeks, and now we're treating Tracy's forehead to offer a brow lift. How does that feel, Tracy?
Warm pricklies, still not overly uncomfortable.
Now, a brow treatment, as we're doing now, may take about 30 minutes. If we're doing a full face and neck treatment, then that can take up to 2 hours. But Tracy will have no downtime, and she can even return to work if she'd like to. We've completed Tracy's treatment, and Tracy may see some initial benefit with lifting of the skin, but it does take time for collagen to grow. So we'll expect peak results between 3 and 6 months, and many people see continued improvement for 12 to 18 months.
Well, I'm really excited. The treatment was not nearly as uncomfortable as I was expecting. I turn 40 next week, so I'm excited to start the new decade looking more refreshed and feeling younger than I have in the past. So thank you.
You're welcome, Tracy.